One. Hello, everybody. Welcome to another episode of Find Your Model Health, the official podcast for those looking to optimize their long-term health and weight goals and understand how their body really works. I'm your host. I'm Shemaine Linney. I'm a nutritional therapist, integrative health practitioner, certified fitness and nutrition specialist, and more. But I'm very happy to have you back with me for another piece of your day. And I hope you find this conversation super interesting and you take away lots of bits that you can start to implement into your lifestyle and continue to support your own health. But before we get into this week's awesome guest, I must remind you that the information in these podcast episodes is for informational purposes only and should not be taken as medical advice. Please consult your health practitioner before making any lifestyle changes. So today, everybody, please help me welcome on Dr. Malaika Woods, whose resume is very impressive. She is duly board certified with the American Board of Obesity Medicine and the American Board of Obstetrics and Gynecology. She's also certified practitioner with the Institute for Functional Medicine. I actually have their founder on in a couple of weeks, believe it or not, Dr. Woods.
Awesome.
And
Awesome.
she also is certified in bioidentical hormone replacement therapy for both men and women. She's also founder of Dr. Woods Wellness. She also has her own book called Physician Unleashed and so much more. So we're going to get into you and your journey and hopefully educate everyone. So let's start with a little bit about you. Why did you decide to become a doctor? And of all, a gynecologist, not the most attractive of professions.
Absolutely. So, Shemaine, my story actually goes back to eighth grade. Back in the eighth grade, I had a very cool honors biology class. It was really cool instructor who's like a former military guy, Mr. Fluke, but he made life sciences so interesting. And I just remember that section of biology when we learned about reproduction. I just had this thought like, wouldn't it be cool to deliver babies? And that's actually how my journey began. And that's how I went into obstetrics. Gynecology comes along with it, but it was my vision to deliver babies. So that's how it started. And then I, veered a little bit off from that about 6 years into private practice. That's when I ventured into kind of the alternative, functional medicine world. And it actually started with just me needing a change in my own life and health. I was a year out from having my second kid. I was up to 240 pounds. I was in a very busy practice, seeing like 30 people a day, being told I needed to see more. So I was very unhappy in my professional life, unhappy in my physical health as well. And I knew I needed to make a change. So I first looked into weight loss, and that's how I got board certified in obesity medicine. I lost 60 pounds over the next 2 years. Then I learned about bioidentical hormones, thought that was amazing. Why didn't I learn that, as a regular OB-GYN? And then thirdly, a good friend of mine, physician, kind of in the early years of my transitioning out of the group and traditional medical practice, I learned about the word functional medicine, kind of root causes, natural solutions. And I was like, mind blown. This is the piece that I've been missing. And that's, when I started my journey of an independent practice. And that's been like 12 years ago now.
Oh, crazy. Don't you notice, or haven't you noticed over the last few years, a lot of, shall we say, conventional doctors transitioning more into the functional and natural medicine world, almost saying like, this can't be right. There has to be something else that we're not being taught.
Absolutely. And I think a lot of the docs are triggered like me, kind of with their own personal health journey, or maybe someone in their family, and they're looking for answers that they're not able to get, in the traditional world, or they're just being so bogged down by the bureaucracy of traditional medicine that they're looking to get out of that.
Yeah, there's more. So with your own journey that caused you to want to know more, especially in hormones, like you said, you hit 240 pounds, you were onto your second baby, you were in a busy practice. Before we do move into everything else, as the weight slowly started to creep up, apart from having babies, what do you think was driving that? Was there?
I think it was stress for me. I think it was stress for sure. Like I said, being in that busy practice, being on call, all of those things really played a role for me. And I think also just getting complacent, sometimes, and I know, there may be, members of your listeners who can identify with, you just get so busy kind of just working and taking care of your family and your kids, you kind of put your own health aside. And, some people have that tendency to reach for food when they're stressed. Other people don't eat. I'm not that one. I tend to reach for food when I'm under stress. And when you're not paying attention to yourself, I think it's easy to just let that creep up. And then before you know it, you're like, oh my gosh, how did I get here?
Yeah. Well, I think secretly we know how we got there, but when you're
Right.
so stressed, what I see happen is like you're grabbing whatever's easy, not just because it's easy,
Hmm.
but there's also a comfort aspect to it. Like we're looking for the
Absolutely.
dopamine hit, but you're almost
Hmm.
saying in your head, I'll deal with this tomorrow when the stress is gone.
Right.
And tomorrow never comes. There's
So
always
sure.
stress.
So true. So true. Yeah, absolutely. And it's almost like on the flip side, when you're talking to people about adopting a change, there's always, an excuse or a reason why they can't do it. Like just a funny story. I had a patient that I was talking about weight loss with, and it was like, it was in the fall sometime. And she was basically like, well, the next 6 months are shot because there's Thanksgiving and there's Christmas and
Mm.
there's like Valentine, like she named all these holidays as the reason why she couldn't make changes in her diet. I was
I
like, wow, that is some kind of mentality. You know what I mean? To have all of those roadblocks and just say you can't, because of, whatever the tradition is for the month. It was a wild to see someone really thinking that way and having so many barriers to making change.
Isn't that insane though? Because even if there was six events or six celebrations throughout the 30-day month, you still have
Hmm.
24 days where you can be on plan and
Yes.
you can make a difference. And I've been practicing in the weight loss world since 2008. So I started at 280 pounds.
Wow.
So like you, I have a lot of experience. And you know what? You can exercise till the cows come home. You can eat good till
Hmm.
the cow. But if your mind is not there,
Right.
you're
Oh
not
my
going to be
gosh.
successful. Although we're looking at ourselves in the physical aspect in the mirror and we're pinching our hips and our love handles, the real weight loss comes from up here.
Mm. So true. Let me actually mention a book that I found very helpful early on with me. It's called The Beck Diet Solution:
Mm,
Train Your Brain to Think Like a Thin Person. That's the subtitle.
yeah.
Because what I found, and she really, first of all, she is the daughter of Beck, who invented cognitive behavioral therapy, or also known as CBT.
Mhm.
And so she uses CBT to help people with their weight loss struggles. And she goes through, sabotaging thoughts, which is the example I gave of the patient that I spoke with. She goes through all of these mentalities that you really need to work through, because often we say, it's not fair, that why is this person thin? Where, even you, Shemaine, someone may look at you now, but they don't know your backstory.
Mm.
They don't know what you had to, struggle through to get to where you are today. So it really helps you overcome those limiting beliefs and those barriers that you put up mentally. I thought it was a great book, and I still recommend it to folks today.
Great. Yeah, I've heard of that book and I actually just took note. Maybe I'll email her and see if she wants to come on. I've had a lot of
Oh,
cognitive
yeah, that would be great.
behavioral therapists on the podcast, but they're more so dealing in relationships and negative thought patterns. It would be interesting. Anyway, we digress. So you are, and I don't think many people are even aware that this is a medical practice, that you can be certified in obesity medicine. So we've heard of weight loss clinics,
Yeah.
all that, but to actually get board certified, what did they teach you? Because it seems like a very basic question, but I know people are going to say, "Oh, I wonder what they're taught there."
That is a great question. And my board certification was probably about 8 to 10 years ago. I was one of the first groups to get this board certification. So, first of all, you have to be like a medical doctor or like a physician's assistant, nurse practitioner to be eligible. And you have to already have a board certification in another specialty. So, I began, OB-GYN is my primary specialty. And then it's coursework that you do. So, it's really teaching you the science behind obesity, the psychological science behind obesity, also teaching us all of the different methodologies to help people lose weight. And so back then, there was no Ozempic or, all of these things that you hear today. Those were not available back then. So there was, they were coming out with some of those combo medications where they were combining maybe phentermine with other things. So they were working toward more long-term medications for weight loss, other than say like phentermine. And then there were also dietary and lifestyle things as well that we were being taught during that training. So it was really a lot of kind of book work, if you will, courses, examinations, and that was really the process there.
Was there something that stood out to you during your studies that you were like, oh my God, I never thought of this in regards to obesity before?
I think the biggest thing for me, and this is when we were really making a push to identify obesity as a disease and stop making it like blaming the person for a shortfall.
Mm.
I think that was a very big piece of it. And then another thing that really stood out to me, like when they showed us, the graphs of the different modalities to help people lose weight, whether it's medication, diet, or surgery, the graphs all look the same, meaning people lose a significant amount of weight initially and everybody starts regaining the weight. So what stood out for me there is that folks who are dealing with obesity, they should really recognize it as a chronic disease. And it's not something that you're going to go on a diet for 3 months or 6 months and fix it. Because just like you said in the beginning, Shemaine, it's the mental part that
Mm.
you really have to work on. And oftentimes I tell folks, it's kind of easy to lose weight, but it's hard to keep the weight off.
Mhm.
That's really the challenge. And so I think that was really highlighted for me when I did my obesity medicine certification.
Yeah, I've cited some studies and statistics with my groups a few times. And one of them just always stuck with me was that less than 5% of people keep the weight off over 5 years. So, in the long term, thankfully, I am
Hmm.
and you are in that 5%. But
Yeah.
it's mind blowing that it's almost saying like 95% of people fail. So you said you
Hmm.
see this U curve. Why, apart from the mindset, why do we think people are not keeping it off?
That is a great question. I think it's multifactorial. I think kind of back to the mindset, it's really the approach that needs to be different because, again, we often take weight loss. Most people take the approach of, I'm going to go on a diet,
Mhm.
right? And that means for a specified period of time. And, you and I, and those of us in these types of spaces, we talk about lifestyle change, which is important, but a lot of people don't really take that to heart. So I think that's part of it. And then I think, when you think about addictions, and some people are really addicted to food, but you can't go off of food completely, right? Whereas people who have an addiction to, say, cigarettes, they could just quit it. Or if you've got addictions to other harder drugs, you can stop that completely. But if you have an addiction to food, you can't just never eat again. So it's just an ongoing battle that you have to contend with, and you have to understand that it's out there. And then you have all the temptations, from advertisements, et cetera. It's just an ongoing battle. And then kind of picking up on the other aspects of health that I work on, Shemaine, hormonal changes, that plays a role, especially with women as they get into the perimenopause, menopausal years. So then you find that, okay, wait a minute, the things that I was doing, eating right and exercising, and I had my mindset pretty well. Now that's all of a sudden not working. Now what do I do? And then, playing into the role of stress and how cortisol, that hormone, can impact your ability to burn fat. So it is often multifactorial, but it really needs to be treated as an ongoing issue. Just like someone who is a diabetic, they never say, I'm no longer a diabetic. Either I'm a diabetic that's well controlled, or I'm a diabetic that's poorly controlled. And so we need to be thinking about that for those who struggle with obesity.
Mm. You know what? When we mention it has to be a lifestyle, Obviously, it does. It does, because a negative lifestyle is going to impact you in the long term. It's going to be your lifestyle. But I almost feel like that word lifestyle has been used so much that it's almost just
Right.
cliche now, that people are like, yeah, 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 I know. And then you're
Mhm.
correct. And I would love to transition into the hormone aspect now. But as we age, the body does become less forgiving to us.
Sure.
When we're younger, yes, conditions are stacked against us, but we're more resilient and we do have the hormonal propensity to play more in our favor. But as we get older, the scale tilts and those stacks get taller and taller again.
Right. Absolutely. So one of the things that happens in that perimenopausal age range, and I'll define that. So first, I'll define menopause, which is a year without a period for women who still have their uterus. If you don't have your uterus, we sort of base it on symptoms, but the average age of menopause is 51. Perimenopause, which just means around the menopause, could be 5 years before you hit menopause, could be even 10 years, but it's just when the hormones are starting to decline and you're starting to get symptoms. It could be something simple like night sweats or hot flashes. It could be changes in your metabolism where you're starting to get that little belly bulge around the middle that's never been there before. And Shemaine, I have women just come in and just kind of grab that midsection and go, where did this come from? You know, it wasn't here before. So those moods, you know, irritability, all of these things could potentially be the perimenopause. And that's when things start to shift. One of the things that's going on hormonally is you're potentially transitioning into something called estrogen dominance. And so, you know, when you look at estrogen and progesterone, I'll just kind of make kind of I'll do this with my hands
My
here,
thoughts are
estrogen and
pretty.
progesterone, right? So normally you have more estrogen than progesterone. But when you start going through perimenopause, menopause, both hormones are declining, but progesterone is declining faster. So you, in essence, become estrogen dominant, even though you may have symptoms of low estrogen, because relatively speaking to your progesterone, you're estrogen dominant. And estrogen dominance is a fat storing state. Estrogen is a fat storing hormone. So that's one of the things that starts to happen as you're starting to transition, you know, again in the 40s and 50s and beyond.
Hmm. So then my followers and clients are pretty well versed in this. I've had Dr. Michael Platt on a couple of times. I don't know if you know who Dr. Platt is. He specializes in bioidentical I've had a lot of practitioners on, so they're pretty well versed in the whole ratio aspect of things. But I want to
Yes.
drive home the idea of, okay, we can blame estrogen, but how is estrogen influencing this weight gain? Is it influencing estrogen or insulin resistance? Is it slowing down thyroid function? How is that working?
That is a great question. So, one aspect of it is just the hormone itself, that it is fat storing. The other aspect, and estrogen is pretty amazing just as far as how many how broad reaching it is as far as how it impacts the body. Even inflammatory factors, et cetera, are impacted by estrogen. And let me be clear, like estrogen is not a negative hormone. It's just about getting those ratios right. And so from that aspect, it's really estrogen itself is more fat storing in that way. And then I think too, like speaking of thyroid, et cetera, you start to just kind of get a little bit of a tick down and decline potentially in these other hormones that also play a role in your metabolism. And so the way that I look at it is, you know, what are all the different factors that play a role in your metabolism and how can we turn the dial in your favor? And typically, if we can turn multiple dials in your favor, we can shift that back to, you know, a metabolic state that's more beneficial for you.
So you mentioned progesterone, and progesterone being our pro-metabolic hormone. What are some of the factors that crush our progesterone or start to cause us to lose progesterone at a higher rate?
Yeah. So one of the basic things, again, when you're going through perimenopause, menopause, what's happening is that your ovaries, which are producing your progesterone, they start to decline. So they're just not producing as much. What's interesting about progesterone and all of these hormones, and you know, one of the things I tell my clients and what I say all the time is that your body is divinely designed and has a great capacity to heal. And so it's pretty amazing when you think about sort of all the interplay of all these hormones. So to give you an example, like progesterone, if you were to look at the cascade of hormones, A few steps down from progesterone, you actually produce cortisol, and cortisol is your stress hormone. So one way you can think about it is if you're overly stressed, you're sort of pulling away from your body's ability to utilize your progesterone. And cortisol, again, is a fat storing hormone. And if we think about cortisol's relationship to thyroid, cortisol can directly block the conversion of inactive to active thyroid. So being stressed can pull from your progesterone. It can actually slow down your thyroid, make you more tired, reduce your metabolism, and you can sort of start to see how all of these things are interconnected.
That's our pregnenolone steal, which I usually just
Yes.
term, I usually for general population don't actually know what pregnenolone is, so I'll just call it the cortisol steal, and they seem to understand
Yes.
that a lot better, which I'm delighted you transitioned into the cortisol because I wanted to speak about that. So you've touched on it a bit there, but when we look at the chronic stress that people are experiencing now,
Hmm.
which is, I feel like it's getting more exacerbated as technology grows and AI grows
Oh,
and
yeah.
social expectations. When we're thinking of that kind of adrenaline dominance, the running high on adrenaline and cortisol left, right, and center all the time, how is that affecting not just the conversion of progesterone, but the conversion of estrogen? And I say estrogen, you say estrogen. um,
Yeah.
the conversion of, like, are we seeing that cortisol is actually increasing estrogen?
I wouldn't say that it's increasing it because estrogen is sort of higher up in that stream. So it may actually be related to that pregnenolone steal, as you call it. Pregnenolone, again, is one of the precursors before progesterone. Another way to think about stress, and I really hone in on this because a lot of times when we say stress, Shemaine, it seems so hard to define. It
Yeah.
seems like something that maybe is not quote unquote real. But the point that I really want to make for your listeners is that your body does not know the difference between an imagined stress and a real stress. So, you think about what is the stress like if a lion is chasing you, right? Heart's racing, you've got blood flowing away from your reproductive and your digestive organs to your major muscle groups so you can run and get away. That's a type of stress that's beneficial for you. But even if you wake up in the middle of the night at 2 a.m. and your heart's pounding because something was chasing you in your sleep, your body does not know the difference. It reacts the same. So I need folks to think about that. So when they're stressed about work or relationships or finances, that chronic stress mechanism, just as if something were chasing you in real life, your body is reacting to that. And I think we've got great data to show how stress can impact your blood pressure, how stress can impact your recovery from illness. And then on the flip side of that, and this is another place where I think we don't spend a lot of time is talking about how do you reduce stress? How do things like prayer and meditation and deep breathing, how do those things impact our health? And again, studies show that, individuals, let's say cancer survival and recovery, studies have shown that individuals who pray or meditate, they do better. So these types of things that have sometimes been thought of as sort of intangibles, they really can have an impact on the physical manifestations of stress on the body.
Yeah, because they're changing your frequency and even altering reductive stress because you're altering how the electrons are moving, and
Yes.
there's a lot more to be considered than people actually realize. It again, it's not just nutrition and exercise. I shared a study in one of my Facebook groups last week, and this study, I can't remember the title of it, but basically said that those who took 1 week break from social media saw tenfold improvements in their mental health, and that
Wow.
included anxiety and depressive tendencies, which goes back to
Hmm.
the more AI and technology advances, the more I see people struggle, and myself included in that. I don't think anybody is exempt nowadays of all these different stressors that we're experiencing. Hence why, and I don't know if you would agree, why so many people are having these hormone issues, because back in the day, we just had to worry about herding cattle and making bread and making the beds. But now, not only are we
Mhm.
doing that, we also have the societal expectations, and we're trying to build a business online, and we're trying to get our word out, and we're naturally, we know we shouldn't be comparing ourselves to other people, that people don't always put out what's true. But I think as
Mhm.
humans, we can't help but compare ourselves. And then that further exacerbates the problems. And um, as much as I believe technology can be great and AI potentially beneficial, it also is problematic, as we're seeing with the increase in mental health issues.
That is a great point. There's a really good documentary out on Netflix about that. I think it came out a couple of years ago. The name of it is escaping me, but it just one of the things that it highlights, and that's how we have to really understand that these companies spend billions of dollars to figure out how to keep us on their platform. You know what I mean? That's number one. So they're working really hard to keep us on there. And then on the flip side, we have to recognize, like you said, Shemaine, that getting yourself pulled in and tied into that can be a very negative and vicious cycle of comparison and not feeling enough and potentially exacerbating or bringing on, depressive or anxiety symptoms that you never even would have had before. And certainly that is a huge shift in our society because we have to be very intentional about unplugging. Whereas, in older societies, even, me growing up, I didn't have a cell phone until I think I was in medical school. So at
Mm.
least I remembered a time without cell phones, okay, and without constant internet access and all of those things. But these newer generations, they don't have that. And so now it's all about being very intentional about unplugging, stepping away, all of those things. We have to be intentional about every aspect of our health.
Yeah, which I feel like myself, yourself, the older generation could be more proactive with. We will become more intentional to put the phone down. But then you look over your shoulder at your children or your teenager, and it's a constant battle to get them to put the
Yes.
phone down. They just, well, of course they're right. They're always right, but they don't like. There's no negative effect of the phone as far as they're concerned. Mom is crazy, they're right, everything we say is wrong. But you see, then, like, I almost stand back and I'm like, oh, I actually have a concern now for my children's mental health and even their
Mhm.
hormones, because I'm seeing the behaviors here. And because of what we do, I can see the ripple effect. This is going to be problematic. So anyway, back to the hormone aspect of things. I did have a client who I was speaking to her this morning, and she's like, "Can you ask Dr. Woods this question? If you don't mind, I'm going to put it to you." She
Sure.
recently had some issues with exposure to, I want to say, bioidentical estrogen, but she seems to be one of these anomalies where she herself calls herself a unicorn, that just the most random stuff can cause her to have a reaction that you will have never heard of before. But she recently got exposure to bioidentical estrogen and then broke out in huge rash, huge autoimmune response,
Mhm.
and so much. But she said, could you ask Dr. Woods, does estrogen or HRT bring on autoimmune things, or would it help reduce the intensity? And I think when she says HRT, she's also including progesterone there, because I know she was using bioidentical progesterone as well.
Mhm. That is a great question. So first off, I would just kind of remind your client and then your audience, remember that these hormones your body naturally produce. Just basically, definitely from menarche when you start your period, etc. So it would be highly unusual for you to have an allergic reaction to your own hormones that your body naturally produces, because that would have come up prior to you and being in this age where you need hormones. Now, what I would question is the modality perhaps that she took in the hormones. Let's say if it were in a cream and maybe there's something in the cream that she's having an allergic reaction to. So I'd more so question the modality potentially, of the hormones and if there's something else that were added to it, because oftentimes there's something else in the preparation, and that might be where she's having a reaction. But no, I don't think there's any connection to like autoimmune disease related to bioidentical hormones. And then let me just define bioidentical hormones as well. It just means that it has the same chemical structure as a hormone that your body naturally produces, but it doesn't mean like it, came from the earth. Like, that may have been produced, in a lab or something. And again, sometimes, like, for example, some bioidentical hormones are derived like from yam. And so that might be something like, if hers were derived from that, does she have a sensitivity or an allergy to that? So I would look at maybe the other ingredients in the hormone, but I wouldn't expect someone to have an allergic reaction to hormones that their body naturally produces.
So since this was a bioidentical estrogen
Hmm.
that was being used vaginally to help with vaginal dryness and tissue regression, it was estriol and it was pharmaceutical grade, so it wasn't any sort of plant-based
Hmm.
product. But she seemed to break out in a huge inflammatory response. She got an infection, she
Wow.
got cysts, and then had to go on antibiotics because it just got out of control. And since then, she got a, shall we say, definite diagnosis of rheumatoid arthritis. So I think
Mm.
there may have been an inclination that there was some sort of autoimmune already, but upon use
Yeah.
of this product, it just seemed to
Hmm.
blow up. Now, you're right, it could have been something else. It just, I suppose
Hmm.
we're trying to connect the dots from my understanding of estrogen being very inflammatory in itself, that if she already has a lot of stress in her life, which she does, then adding in this inflammatory molecule could have just been enough of a trigger to blow up everything. And then she had this huge immune response. But yeah, it was scary. She was on IV, she was on.
Yeah. Wow. Yeah. And like I said, I wonder more about some of the ingredients in the topical because sometimes people don't respond to that. And estrogen is an interesting product because there are some components of estrogen that are inflammatory, but there are also some aspects of estrogen that are anti-inflammatory. Like when you think about how estrogen reduces cardiovascular disease risk, particularly we see that in women who are on hormones as they go into their 50s and beyond. And some of that protection against cardiovascular disease risk is actually related to anti-inflammatory impact. So estrogen is a complex hormone for sure. And if you're, regardless of what the trigger was, for your client, if you had a huge inflammatory response to something, certainly that could have been a tipping point for her if she was already predisposed or whatever to
Mhm.
rheumatoid arthritis. We do see that quite frequently where an autoimmune disease typically can have some sort of a trigger. That point, I definitely could see that.
Mm. Do you think if she's, because progesterone, again being a pro-metabolic, more anti-inflammatory hormone, would be a good tool for her to utilize now to try get some of that inflammation under control? She's definitely adrenaline dominant as well.
Mhm, mhm. I can't speak to that, specifically, for that particular person. But I would also just talk also about just some of the common ways to deal with anti-inflammation as well. So, obviously looking at inflammatory foods in the diet, and then looking at, other supplements that are anti-inflammatory, whether it's fish oil or turmeric or things like that. Those are definitely basic things. And then I would for sure have her go back and speak, with her bioidentical hormone specialist about whether or not progesterone is right for her too. I love to use progesterone in my clients. I find that it has some really great benefits. So that is definitely something I think she should go back and ask about.
Under what conditions are you using bioidentical progesterone with your clients?
So most of my women who go on bioidentical hormones, we're going to use progesterone. I call it the secret weapon hormone because it has a couple of really great benefits. It helps with, it has a natural sedative effect. And so I find so many women are having trouble sleeping, and progesterone can be a great natural way to give the body back something that's missing versus getting a prescription for, an insomnia medication.
Mhm.
And then secondly, progesterone has a calming effect. So it literally works on the GABA receptors of the brain, which are those calming neurotransmitters. And so I love to use it for that. And then it's got other added benefits. So for women who are having heavy bleeding or irregular periods, progesterone is great for that too. So it is a very foundational piece as far as when I'm looking to get someone on bioidentical hormone replacement therapy. And I also find too, Shemaine, that progesterone is something that you can use in younger women, whereas estrogen, I would not. And so this is something else about your client that I would be curious about, sort of what were her estrogen levels? Because I think the mistake that some HRT practitioners make, those who are not well versed, they give estrogen too early.
Mm.
And so let's say a woman who's say 45 and she's having regular periods, even if she's having, let's say, some hot flashes, et cetera, you're not going to give her systemic estrogen
Mm.
necessarily because you're going to potentially overshoot that and really put her maybe perhaps further into estrogen dominance. So
Mm.
you kind of, we call the perimenopausal range, especially as it relates to estrogen levels, we call it kind of no man's land, meaning anything could be happening. You know, one day it's super high, another day it's super low. So you really want to be careful about giving estrogen too early in the course of a woman kind of going through perimenopause, menopause, whereas progesterone, you can start using early. And I like to use testosterone as well. And that one you can use early also. But estrogen is really the last one to add because you don't want to overshoot what the body's already doing and the body is already a little bit haywire during that time frame as far as estrogen production.
Mm. And I don't know if you agree, but especially if someone does have a lot of weight to lose, we know the fat cells are already going to be making that extra estrogen as well.
That is
The
correct. Yes.
majority of people, myself included, I believe are estrogen dominance. And even though I'm slim now and the average person wouldn't look at me as estrogen dominant, for sure I have all the markers. I can see it in myself. And then you throw in stress.
Hmm.
So yeah, my progesterone plummeted until I started using bioidentical progesterone almost a year ago. I was haywire, and I'm still pretty young, I like to think, but,
Yes.
for sure, estrogen dominance is a trait in most people, back to it's just how society is now, we've stress everywhere. But you mentioned testosterone, because when we come to female hormones, not many women would consider testosterone. We more think of it as the male dominant hormone.
Hmm. Hmm.
And there's not from my perception, there's not a lot of practitioners that will, for sure not in Canada, from what I've seen, are prescribing testosterone to women. What are
Hmm.
you looking for in regards to markers or some symptoms to tell you, yeah, she'll probably benefit from some testosterone?
Yeah, for sure. So what I do, like first off, I like to get objective data. So I like to get actual lab work and you can see what the testosterone numbers are. You could also look at certain symptoms, you know, to show that testosterone is declining. So it could be reduction in libido. It could be, you know, reduction or enhancement in orgasm. Those could be reduction in orgasm, not enhancement. Those could be some of the symptoms. Loss of muscle mass or just strength
Mm.
could be another symptom, even brain fog. And so here's the thing that I really try to educate women on is that testosterone is not just for men. It is important for women also. And testosterone is not just about sexual function. That is also a misconception. And so the non-sexual benefits of testosterone, which could be very powerful, our energy, mental clarity, and building muscle mass over time so that you can burn fat more efficiently. Of
Mm.
course, it's not a weight loss fix, but it's a little dial that you can turn in your favor. And there's actually some good data, Shemaine, also to support the use of testosterone in women. There's a doc here in the US. She's based out of Ohio. She published a paper of 10,000 of her women patients on testosterone.
Mm.
And she showed their average testosterone levels. She showed that they had minimal side effects, and only about 5 to 10% of them had any side effects that we would think of. So, you know, nobody's growing a beard or nobody's voice is, you know, turning manly or anything like that. But it's actually very well tolerated and they're seeing great benefit from it.
How were they administering that? Was it oral or?
Yeah, we don't give it oral. We give it either in the form of a cream, in the form of a troche, which is like a throat lozenge. You just hold it in your mouth. You can give it in the form of an injection, intramuscular. You can give it in the form of a pellet. A pellet is like a compressed powder of hormone, like the size of a Tic Tac or smaller. Typically, that's a procedure that's done in the office. A little incision is made in the upper outer buttock area. The pellet is placed in the fatty tissue, and it's like a little depot, and it's slowly released in the body over the course of about 3 to 4 months.
Okay. So
Mhm.
it's a tad, shall we say, a tad bit challenging to get hormones in Canada.
Mhm.
Um, a lot of practitioners are reluctant to not only prescribe but test for hormones. So, for women who would be interested in, to put it plainly, boosting their testosterone or progesterone, what would you have some natural recommendations that we could see that encouraging growth of these hormones?
Yeah, so again, it goes first of all back to basics. So looking at your diet, taking out inflammatory foods is going to be a big one, reducing stress, getting enough sleep. Those are all the simple things. Exercise definitely increases your testosterone levels. So those are some of the basic things that you can do. There are some herbs that have been shown to help with like hormone balance, and I'm putting balance in quotes, okay?
Mhm.
And we should probably say kind of hormone supportive,
Yeah.
so whether that's like chaste tree, magnesium, dim, which is found in cruciferous vegetables, but you can also get that in a more condensed supplement version. Chrysin, these are some of those kind of herbs, supplements, etc., that have been known to help as far as shifting you in a more favorable hormonal pattern during that phase of life.
Mm. Well, most of those, if I'm correct, are more beneficial for progesterone and again supporting progesterone.
Yes, yes,
Um,
yes.
Apart from, I think, optimizing sleep, protein, maybe weightlifting, is there something else that we could do to help with testosterone levels, especially in regards to libido?
Mhm, mhm. You know what's interesting about that? Libido is a very complex situation for women
Mhm.
because it's not just your testosterone level, but it's also the health of your relationship. It's also your own personal image of yourself, the image of your body as well. So all of those things play a role also. And so for women who are dealing with low libido and you've tried, exercise, diet, etc., then you need to look into those sort of deeper psychological things as well, because it's going to play a role. Like if you're in an unhealthy relationship, you're not going to want to have sex. And the thing with women, and what's been shown, is that if you have a positive sexual encounter, that feeds interest for the next time.
Yeah.
And so you can kind of think about that. Like if you've had an argument with your significant other, you're like, Get out of my face," right? But for a man, like they're always interested. It doesn't matter. Like that's sort of how their libido works, whereas ours is more complicated than that.
Yeah, I say, because people ask me about libido all the time, it almost seems to be an epidemic. I'm like, if
Yes,
you are super stressed, the last thing you want to do is have sex. I mean,
of
a
course.
hot bath and a glass of wine is way more appealing to me than,
Absolutely. And going back to you had mentioned the pregnenolone steal. Again, testosterone is in that cascade too.
Mhm.
So if you're stressed, you're going to be pulling away from your body's ability to produce testosterone also. It is affected in that same hormonal cascade.
Yeah. So, ladies, gentlemen, stress, low hormones is kind of the be all there. I'm curious as to your opinion back to estrogen, and I feel it's becoming more of a controversial topic. The more the research is coming out, the more independent researchers are kind of doing their own stuff. I'm not sure if you're aware of who Dr. Ray Peat is, but I'm sure you're aware of who Dr. Joe Mercola is.
Mhm.
Um, and both of those well-known experienced doctors are adamant that under no conditions would they be prescribing or supplementing women, especially with estrogen. And their reasoning behind that is that estrogen basically being very poisonous to the body, that women make estrogen until the day they die. They also propose that serum levels of estrogen are not accurate, that estrogen predominantly gets stored in the tissues. And I'm sure you know, like most general practitioners are not testing tissue levels at all. They're just
Mhm.
not. So they're adamant that under no circumstances are they prescribing estrogen. Of course, huge fans of progesterone and pregnenolone and testosterone, but estrogen is like a big no-no. And I know Dr. Mercola is getting a lot more outspoken about this over the last few months. So I'd love to hear your opinion on that.
Yeah, for sure. So, of course, I think we have to recognize that every physician or practitioner is going to come sort of from their perspective. So we
Mm.
have to understand that, number one. So as an OB-GYN, and then also being trained in bioidentical hormone replacement therapy, I have a different perspective, but it's not just perspective, as Shemaine, it's having spent the time to review the literature to get a good understanding of it. And I think each individual physician or practitioner does that differently also. So I'll start with that sort of on the outset. I think the big scare from hormones began in 2002 with the Women's Health Initiative study, where they were comparing Premarin versus Prempro. They stopped it early because of an increased risk of breast cancer, heart attack, and stroke. 20 years later, they have rehashed that data. I think one of the biggest things that came out of that is that the synthetic progestin, medroxyprogesterone acetate, was one of the biggest culprits as it related to that increased risk of breast cancer, heart attack, and stroke. Even in that study, when they looked at the synthetic estrogen, they did not see that increased risk of heart attack, breast cancer, and stroke. Now, there have been studies prior to and since then. Some of them are observational, like the Nurses Health Study, where they follow women for, I don't know, 20, 30 years, and they see that women who are on hormones have a 30 to 50% reduction in cardiovascular disease. We see women on, and I mean estrogen, women on estrogen have a 30% reduction in colon cancer, 30% reduction in osteoporosis. And so we see benefit, reduction in dementia and Alzheimer's. There's also a great book out that I think summarizes a lot of this called Estrogen Matters. And this is a cancer doctor, a male doctor, Dr. Avram, who was looking into this whole controversy because his wife was going through menopause and trying to figure out, should I give her estrogen or not?
Mm.
And so I think there's very solid data to support the safety and the benefit of estrogen. I think, people will kind of get on their soapbox and stand on it. And I'm sure that Dr. Mercola has reasons for that. But I am also very confident in standing on my soapbox that estrogen is beneficial for most women if used appropriately.
Yeah. Well, thank you for that, because I know I kind of put you on the spot there. And you're
Yeah.
correct. It is important to get the different perspectives, and different practitioners are going to approach things from what they deem to be applicable for their clients and also their experience,
Yes.
because you're doing this quite a long time as well. So thank you for that. But I also
Absolutely.
wanted to ask the whole cancer topic, because another thing again, Dr. Mercola, and I'm not friends with Dr. Mercola per se, but um, a huge advocate for avoiding estrogen. As he would put it, that estrogen is one of the main drivers of cancer. So cancer being predominantly driven by PUFAs, cortisol, and estrogen, I believe is what he says. So, and not just hormone dependent cancers, it's all cancers. And you probably don't know who Georgi Dinkoff is. So he's an independent researcher, and he was on the podcast a couple of weeks ago. The same thing through his research, saying that, well, actually, it's not just hormone dependent, it is all cancers now. We're seeing estrogen play a part. So I'd love your opinion on that as well.
Yeah, I think there's another thing that needs to be delineated. And I'm not sure sort of when they say their research, what do they mean by that? But just in a broad sense, think about the fact that your own estrogen levels are highest during your reproductive years.
Mhm.
Again, I have to remind people that this is a hormone that your body naturally produces. So then why all of a sudden, when you get in your 40s and 50s and you have some replacement, not even to the level that you were producing on your own, I would be curious to hear them explain, why does it cause cancer now? Because if estrogen is such a cancer causing hormone, why don't you see it in a reproductive woman? Because that's when her estrogen is at its highest. And so I think part of the distinction that needs to be made is that there's a difference between causation and association. And there's a difference between when you intervene and you see the result versus if you make an association. So let's say, for example, with obesity and estrogen, just like you mentioned earlier in our talk today, Shemaine, how your fat cells make a little bit of weak estrogen. And so that means there's an association between obesity and estrogen. But does that mean if I give you estrogen, does that cause obesity? Does that cause the aftermath of obesity, like diabetes, heart disease, et cetera? You don't see that in the studies. And so I think that's where people kind of have a little bit of a different soapbox and an approach, because my approach and the way that I look at estrogen is I'm going to attribute to estrogen a negative health outcome if you show me a study where I give someone estrogen and then they have negative health outcomes. Oftentimes, in my experience in looking at these studies in the past, what they're showing you is that it's an association. So I see higher estrogen levels in people who are obese, so I am assuming that the estrogen causes obesity. And I think that that is potentially a fallacy in the way that you're looking at that. And again, you can look at the actual interventional data, give estrogen, and then tell me what happens
Mhm.
versus giving me an association. And I think that is part of where people kind of stand on different sides of that fence.
I think a lot of the argument is that um, when we're younger, our hormones are more optimal. But again, as we age, we lose the progesterone and we don't have the
Mhm.
progesterone to offset the estrogen. So then they don't want to add estrogen to the burden. So I think a lot of the argument is that, and the transition of the changes in hormones as we transition through life. So a lot of it back to progesterone, which is why they're such huge promoters of progesterone. And we
Mhm.
are too,
And
because there's so many
yeah,
benefits to it. But again, another curveball. So thank you for that. These
yeah,
questions are on people's minds, and they don't always get asked. And I think we should have open conversation. Back to, some
sure.
practitioners will perceive things one way and others, and then us as followers and consumers of the information, we can then decide which direction maybe we're going to go on with more educated kind of outlook on things. So thank you for that. So you do well. There was one last thing, and I'm not sure how well versed, but I'm going to throw it out there. You would be in the connection
Sure.
between estrogen and serotonin, and how they connect, and the potential problems that might be there. And I'm not trying to demonize estrogen. I'm genuinely curious.
Hmm. I don't have a lot of comment on that connection between estrogen and serotonin. I mean, we know that a lot of it is produced in the gut, and that's why the gut is such an important piece as far as overall optimization.
Yeah.
And I think that's the bigger piece too, Shemaine, is first of all, really taking a comprehensive approach. So the way that I explain what I do and what approach I think is best, take the functional medicine comprehensive health approach. And so I hate to see anyone just say, I'm going to get on hormones and that's going to solve all my problems,
Mm.
because you really need to address all of the important pillars as far as really optimizing your health. I think that's number one. And then number two, I think it's important for each individual to have a conversation with their physician or practitioner. Hopefully, they're going to go to someone who has some expertise. And the other thing that I like to say too is that I got a lot of tools in my tool belt. So for some women, and there's the thing, like I'm not necessarily trying to convince someone that they should be on estrogen. I'm just going to give them the data the way that I understand it and my experience. And it's a conversation, and we decide together which hormones are best for each individual person. I think that's the bigger story, It needs to be individualized more than anything else, and the comprehensive approach really is best.
You're correct. And thank you for saying that. So many people think that if I just get hormones, all of my problems are going to be solved, when really we have to start with the nutrition and optimizing sleep
Yes.
first before you even consider hormones. And that can be sometimes even a month with my clients. I'm like, I'm not even going to discuss that until we have your nutrition and your sleep down pat. And
Hmm.
then we will look at other stuff because, as I'm sure you'll agree, sometimes that's all it takes. People's practices, lifestyle practices are so
Yes.
bad that
Hmm.
just making those few tweaks can really turn around a lot of what they're perceiving as hormonal issues. Um,
Absolutely.
I do want
Absolutely.
to discuss your book, but I know somebody's going to be asking, and if you don't mind, if someone did walk into your office, what kind of symptoms are you looking for or markers that would have you say she might benefit from estrogen or progesterone? Are you kind of listening for the low libido, the vaginal dryness, the burning, bleeding upon wiping? Like, what are you looking for before you? I know there's a huge picture, but I suppose I'm just looking for,
Yes.
the signs you may need some estrogen or progesterone.
Absolutely. I would say, first of all, women come to me when they're at the point of they just have a sense of not feeling well.
Mm.
They have a sense that something is off in their body, and oftentimes they're not sure what it is. Now, some of those symptoms are going to be hot flashes, night sweats, vaginal dryness, but they also just say, I feel off.
Mhm.
I'm moody, I'm irritable. They've got that weight gain around the middle. They're not dealing with stress as well as they did in the past. And they've reached that tipping point. So usually when they come to me, they're at the point of frustration. So they've already been to their traditional doctor, they got no answers, or they got, just basically suck it up, buttercup. It's just, you got to
You're
deal
getting
with it
both.
without really
Yeah.
giving them any strategies. Exactly. So that's usually when they come to me. And that's when we start to dig a little bit deeper. I like to get a comprehensive lab panel. We do a comprehensive history, and we work on all those pillars again: sleep, nutrition, lifestyle, dealing with inflammation, all of those things. Hormones is where, really the approach that we take when we're helping people just get back to their optimal level of health.
And your book then includes some of these kind of guidelines slash practices that you're doing with your in-clinic clients?
Actually, the book is actually for physicians. So the book is called Physician Unleashed, the Physician Freedom Formula. So I wrote that book to help other physicians who are looking to start or grow an independent practice.
Mhm. And well, no doubt the general public, if they can understand a lot of the lingo, will benefit from it on some level with the book. So for us practitioners, it's kind of your step-by-step approach of how to approach these different, shall we say, individualities and different clients.
It's actually more of a marketing business book. So kind of think of it that way. It's sort of the strategies to market your practice to get your message out. So again, it's for those practitioners who are looking for some techniques to grow their practice, not really for the individual client.
Well, uh, I know, and this is just a side thought. I know there's a lot of my clients who they constantly say, do you have any courses that you'd recommend? I'm interested in getting into some sort of bioidentical therapy. As we both know, it's not that easy, but it's definitely something that seems to be on a lot of people's minds a lot more lately. So who are you? I know for practitioners, but do you see in your mind's eye a specific practitioner, a specific person that you're targeting this towards, or is it just someone who's already in the health industry but wants to maybe take their business to the next level?
Yeah, it's both of those. Those who are thinking to get started and those who have just started, it's for them. Now, for the client who wants to know more about hormones, et cetera, I would definitely invite them to take a look. I have a Facebook group called the Natural Hormone Fix,
Mhm.
and we talk about natural solutions, root causes as it relates to hormones, but we don't shy away from talking about hormones and the benefits of them specifically. If they just want to consume a little bit more information, and understand more about it, that's a place they can check out as well. Again, it's called
That's
the
the
Natural Hormone Fix. Yeah, that's on Facebook.
So here's a bit of a dilemma that I have, and then I'll let you go. Is in Canada, as I mentioned, it's pretty hard to get your hands on bioidentical hormones, and I mean USP grade, not plant-based. Um,
Hmm.
Doctors reluctant to not only test but prescribe. Like it's pretty difficult. If
Hmm.
many moons ago, it used to be easy, like it is in the States. You could get some sort of over the counter pharmaceutical grade hormone, but they abolished that. Many people propose because of the money factor. But
Hmm.
so now it's hard. So back to what I was saying, if someone like myself wanted to then go into, well, not myself because I'm already in the area of hormones, but another one of my colleagues wants to then move more into hormones and they're going to utilize your book. Is there, oh, how do I word this? Is there a way to advise how to get hormones for the client, or are you going to mostly focus on the plant-based molecules?
The book is really more about, marketing the practice more so, is what it's about. As far as if I'm understanding you right, like helping those in Canada get access, is
Yeah,
that what you mean?
yeah,
Or
get their
okay.
get their
I would probably Gotcha. I would probably direct them to some of the bigger organizations that may have a little bit of sort of an insight into how to do that. Whether that is World Link Medical is a place where I did my training on bioidentical hormones, and there are different companies that are associated with them, and they may have a little bit more of an inroad as far as is there a way to get hormones to the Canadians as well.
Yeah, it's pretty challenging. And it's half of the battle in what I do is trying to get the hormones here because as we
Hmm.
both know, like they're so beneficial and to keep them from people is a disservice when people can greatly benefit from them.
Absolutely. Yeah.
So I know I throw you a lot of curveballs in the last hour. So thank you for taking all them. But it's just, I find these flows of conversation go a lot better, but you were well able for my questions. So thank
Yeah,
you.
I love it. Yeah, great questions.
So I will share your Facebook group and your book. Is there anywhere else you'd like to direct people to where they can kind of follow you more and see a lot more of your content and what you're talking about?
Yeah, absolutely. So again, I mentioned the Facebook group called the Natural Hormone Fix. I also have a YouTube channel, Dr. Woods Wellness, and I like to put out just informative videos all about menopause. Like all those questions that people have about menopause, I'm creating a catalog of videos just to answer that. I'm on Instagram at Malaika Woods MD as well.
I believe we follow each other, if I'm not mistaken. I think we do.
All right, we'll make
Well,
sure after this.
thank you for your time and thank you for taking both the hard and the easy questions.
Yeah, no problem. I love a great conversation about all of this.
Thank you, Dr. Woods.